Adipose, or fat reduction. Caffeine, part of the methylxanthine family, is a naturally occurring stimulant. It affects the central nervous system, the myocardium, promotes diuresis, and also promotes the release of the hormone epinephrine. An alteration that you'll see is calcium handling in muscle, as well as the sodium-potassium pump can be changed. Cyclic AMP, which is part of the second messaging system that cells have, so it will have an effect on the cyclic AMP. Glycogen phosphorylase will also be affected, so that causes the release of glucose from stored glycogen in muscle. Sources of caffeine, we've got tea, coffee, chocolate, soda, and of course tablets. The claim here is that we'll increase lipolysis in both muscle and adipose tissue, which will release free fatty acids and increase the availability of intramuscular triglycerides, which would then promote fat oxidation and spare muscle glycogen under moderate exercise intensity conditions. This spells increased performance and, of course, alertness. The efficacy and evidence for using caffeine, there's quite a number of studies out there that you'll see. Many of them do show that there is a glycogen sparing effect within the first 15 to 20 minutes of submaximal exercise. Typically, studies with caffeine have been done in cyclists, more so than running. However, there may be some benefit in either way. Usually, these folks are exercising more than an hour, so it's not really going to be useful for those individuals who are exercising for, let's say, 20 minutes or so. The side effects, the International Olympic Committee considers this a substance that if you consume enough of it will give you a positive urinary test, so you'd fail your test, more than 12 micrograms per milliliter in urine. The side effects that some people experience: tremors, tachycardia, so accelerated heart rate over 100 beats per minute at rest, headaches, dehydration. Some people don't respond, and this comes from habituation sometimes. If you're a habitual coffee drinker, for example, you may not actually respond to caffeine, so you need to make yourself caffeine naive, which you can do without consuming caffeinated products for about 4 to 5 days, and then have your dose just before your sporting event. The application of this, the traditional dose is about 6 to 9 milligrams per kilogram of body mass, just about an hour before your athletic event. The new recommendations are to consume 1 to 3 milligrams per kilogram of body mass, and it may be best to consume this caffeine with carbohydrate just about an hour before the event. Sometimes using 1 milligram per kilogram of body mass doses over 2 hours may work better. You'll have to experiment with the athlete. Coffee might not be the best source simply because there are other chemicals in coffee that could lead to degradations in performance. So the real world application might be difficult, but you have to practice the use of this supplement as well as other supplements as far as whether or not it's going to work for the athlete. This is a table just showing the milligram content of caffeine in a variety of food products. So you may want to take a look at this a little bit more closely. Okay, carnitine, the L or D version, is a protein. There's 98% of it found in skeletal and cardiac muscle, and its main job is to transport long-chain fatty acids into the mitochondria via some enzymes, which I'll show you on the next slide in a diagram, so that we can use these fatty acids for beta oxidation, that is, to utilize them to make ATP. It's also used to transport excess coenzyme A, which is part of the acetyl-CoA that we get from the conversion of pyruvate to the next step in the citric acid cycle, which is acetyl-CoA. We use that to get some of the intermediates out of the mitochondria during high-intensity exercise. Enough flux through the tricarboxylic acid cycle so that you can get pyruvate dehydrogenase inhibition, which converts pyruvate to acetyl. So you're relying more so on fat to be transported and slowing down the contribution of glycolysis end products like pyruvate to be oxidized for fuel. So there's more reliance on fat oxidation. Sources of this, it's produced endogenously, two amino acids, lysine and methionine. You can find it also in meat, poultry, fish, dairy products, peanuts. The claim here is that we're going to increase the amount of transport of fatty acids and therefore enhance fat oxidation and enhance the amount of fat loss that you would get. So you'd get, quote unquote, ripped. Then, by doing this, you could also improve exercise performance, endurance performance in particular. The evidence and efficacy is weak in healthy people. Carnitine losses on a regular basis is kind of negligible, even in exercising individuals. So proceed with caution, because L-carnitine in the L form is safe, but if you have someone who's consuming the D form of carnitine, that actually can deplete L-carnitine, and then you can get into a deficiency state. The application of this substance is 2 to 6 grams per day. Might actually benefit patients who have a true carnitine deficiency. So if you're going to replace carnitine in their diet, then this actually may help. There's some indication that peripheral artery disease, or PAD for short, can actually improve circulation and fat oxidation in these patients. There are a few studies out there that show some benefit, and perhaps vegetarians whose diet might be low in both lysine and methionine, and which may limit the production of carnitine. So here's that diagram I was telling you about, and if we just start over here on the left-hand side, or I should say middle left-hand side, right here is your starting point where you have fatty acids that combine with carnitine via the CPT enzyme, so that you get fatty acid carnitine, which then gets transported across the mitochondrial membrane, and fatty acid carnitine then can release the fatty acid once again to undergo beta oxidation, so you can make some ATP via that process. You can also, once carnitine is complete, ship it back out across that mitochondrial membrane so that you can promote more fatty acid transport into the mitochondria for use as a fuel during exercise. Okay, chitosan. Chitosan is a type of dietary fiber. It's made up of an amino polysaccharide, so there's an amino acid and a polysaccharide, a carbohydrate, very large carbohydrate attached to this. It's positively charged, which is important in the claim here. We can get this from shells of shellfish, so grinding up a bunch of shells and extracting the chitosan. And the claim is that we can bind to negatively charged fatty acids, remember this is a positively charged substance, in the gastrointestinal tract, so that you can block absorption of fat. Again, trying to reduce the amount of fat that we consume, and therefore that would presumably force us to tap into our adipose reserves. The efficacy and evidence, it's mixed data currently. We really need more research to figure out what's going on here, and if in fact this has a real effect. Side effects of this. Well, anytime you reduce the amount of fat in somebody's diet, that will affect or could affect the fat-soluble vitamins, because you need fat in order to absorb fat-soluble vitamins. So that's a problem that may happen, is that you'll reduce the amount of fat-soluble vitamins that are being absorbed across the gastrointestinal tract. Gas, bloating, diarrhea, all side effects here. In individuals who are allergic to shellfish, that's always a concern that perhaps they'll be allergic to chitosan, since it is formed from grinding up the shells of shellfish. Application of this substance is 2 to 6 grams per day, about 1 gram dose per meal. Chromium. Chromium is an essential trace mineral. About 25 to 35 micrograms per day is what we need. It's found as picolinate, nicotinate, and chloride sources. We can get it from yeast, nuts, legumes, fruits, vegetables, chocolate, wine and beer, wheat germ, mushrooms, and American cheese. It's interesting that only about 3% of what's ingested is actually absorbed across the enterocytes and into the bloodstream. Some simple sugars may actually block the absorption of chromium, so that's also a concern if chromium sources are not rich in the person's diet. So the claim here is that chromium can actually enhance insulin's action, that is taking up glucose into cells, promoting amino acids going into cells, and performing anabolism, building proteins, and also fat processing, so forcing the fat to be utilized for energy. Immune function as well, there seems to be a role there, and there are some claims of increased muscle mass and strength, and of course reductions in overall adipocyte tissue or fat mass. The efficacy and evidence for this is kind of weak, although there are a number of studies out there that have attempted to look at chromium picolinate, especially as a way to reduce fat mass. Side effects from this. Picolinate may be toxic. We still need to investigate that a little bit further. You might develop an iron deficiency as a result of this because in order to transport chromium, it actually binds to transferrin, which is a protein that carries around chromium as well as iron. So if there's competition there with too much chromium, chromium is going to win because the concentration is higher, and therefore you get more binding to transferrin. So you may become iron deficient. Kidney failure from toxicity, that's a concern. Rhabdomyolysis, which is a skeletal muscle disease where you get myoglobin in urine, that's the hemoglobin form in muscle that carries oxygen to muscle, so that could be a problem. At high doses, it actually may be a pro-oxidant, so you might get some DNA damage there. And in combination with vitamin C, chromium may actually be even more dangerous because vitamin C is going to enhance the effect of chromium as far as a free radical is concerned, becoming a pro-oxidant. The application of this, about 120 micrograms per day, and patients with deficiencies in hyperglycemia may actually benefit from chromium supplementation. Conjugated linoleic acid, or CLA, it's an isomer of linoleic acid, which is a fatty acid. The sources, meat, dairy products, usually foods that are high in saturated fat. Supplements commonly use vegetable oil sources, which may not have the same effect. So it seems like the animal sources are the ones that are having the claims of weight loss, muscle hypertrophy, and enhanced endurance as an adaptogen, and also anti-cancer properties. As far as the efficacy and evidence, much of the work that has been done in this area has shown some moderate weight loss in overweight adults. So whether or not it's going to work in an athlete is questionable. The side effects here, perhaps insulin resistance may increase, or even promotion of oxidative stress, since this is a fatty acid, and it does alter the phospholipid membrane characteristics as far as the makeup of fatty acids within that phospholipid bilayer. So that's always a concern there. The application of it, about 3 to 6 grams per day for about 4 to 12 weeks. Cyclo-HisPro, or CHP, this is a peptide that's a metabolite from thyrotropin-releasing hormone, so a thyroid hormone. It's also found in the central nervous system, the gastrointestinal tract, in breast milk, in blood, cerebrospinal fluid, and urine. Some food sources: tuna, shrimp, ham, some casein, which is a milk protein, or even some soy protein supplements are sources of Cyclo-HisPro. The claim here is that you're going to get some appetite suppression, also reduced ethanol necrosis, which would relieve some central nervous system depression if that's present. Decreases in cholesterol synthesis, so it may lower overall total cholesterol in the blood, and inhibition of insulin secretion. The efficacy and evidence for this, it seems like there's some promise here, but again, caution's warranted because we need to explore this more in a research context to tease out some of these effects a little bit more. Some of the side effects, It may decrease breast milk production, so that's probably not a good time when a female athlete is pregnant to consume this substance. And testosterone may also be reduced via prolactin, that hormone. As far as other side effects goes, decreases in insulin release, which may have negative effects on muscle mass. If you decrease the amount of insulin that's being released, insulin's anabolic, so there's muscle building qualities about insulin, and that may have a negative impact on muscle mass, so we're not sure. The application of this is, there's really nothing set in stone currently, so you need to just follow the manufacturer's recommendations on the bottle. Dehydroepiandrosterone, or DHEA. This is a prohormone. It's a precursor to testosterone, and it's produced by the adrenal glands, and usually the levels end up decreasing with age, especially around middle age, around 40 years of age or so. It's produced endogenously from cholesterol, but we also get it from food, from wild yams and Austrian pine seeds. Pollen also contains DHEA. The claim here is that we can increase the levels of testosterone. So because it's a pre-hormone or prohormone and a precursor to testosterone, the idea is that if we consume more of this substance, that it'll be converted into testosterone, which would then increase muscle mass, and it would prevent obesity by preventing more calories being shifted over to storage in adipocytes. There's also the claim of enhanced immune function and decreased insulin resistance. The efficacy and evidence for these properties, as far as anabolic properties or immune function, it doesn't seem like there's anything there that's appreciable. But in 40 to 70-year-olds, it actually may help increase muscle mass and increase bone mineral density and enhance the immune system. In older men, it seems to decrease body fat, but in women it seems to increase body fat. So we're not quite sure what's going on there. More research is definitely warranted with this supplement. As far as side effects go, it seems that it may reduce the amount of HDL cholesterol. Remember, that's the good kind of cholesterol that protects us against atherosclerosis, so the buildup of plaque in coronary arteries and other blood vessels. So that it may actually increase our risk for dying of a heart attack. It seems that it will decrease insulin sensitivity, so does it prone us to diabetes and problems in regulating blood glucose? We're not sure. It may or may not. It may decrease overall total cholesterol and LDL cholesterol in men, which is not necessarily a bad thing, because that can reduce our risk for cardiovascular disease. It may increase estrogen levels, and in men this may be a problem because that may lead to prostate cancer. It may lead to virilization in women, gynecomastia in men, so men develop breast tissue. It's currently banned by the International Olympic Committee, and there are some drug interactions that you should be aware of. So if you have an athlete that's planning on taking this substance or is on this substance, you want to make sure that they're not taking any of these other medications here. The application of this is about 25 to 100 milligrams per day, and usually for individuals with suppressed DHEA blood concentrations, this actually does help bring those levels back up again. Ephedrine, it's an extracted stimulant. It's a beta-2 agonist. It's going to mimic norepinephrine, and it doesn't appear by itself in fat loss products. It's usually combined with other substances. Interestingly enough, it can be used to make methamphetamine, or otherwise known as speed, crank meth, or crystal. Some sources of this, ephedra and mahuang. So if you see those on a bottle, that's where it's coming from. The claim here is that you can improve lipolysis or increase lipolysis. You can increase heart rate, the contractility of the heart, so the heart actually can contract more forcefully. You can increase glycolysis, so you're going to make more ATP using glycolysis, and increase your basal metabolic rate. So metabolic rate overall increases, which means that you're going to burn more calories doing whatever it is that you're doing throughout the day, simply by ingesting this substance. The efficacy and evidence for this, it's effective for weight loss. It's been shown over and over again that you can use ephedrine to reduce the amount of adipose tissue. Problem is, as far as the side effects goes, is illegal in the United States, and this happened because of there are a number of cases where people died from taking ephedrine because they overconsumed it. So they overdosed on ephedrine. But other side effects include tremors, dizziness, insomnia, so you can't sleep, arrhythmias in the heart, headaches, dehydration, and of course, as I mentioned, death. The application of this, no more than 100 milligrams of ephedra per day, 20 milligrams of ephedrine plus 200 milligrams of caffeine per day. It's usually found in that combination if you do see this substance anywhere. It's sometimes combined with aspirin to enhance the effect, so it's called an ECA stack. Enterostatin. This is a peptide form in the gastric lumen from cleaving procolipase, and it's basically endogenously produced. And the claim is that it's going to inhibit fat intake selectively via satiety receptors in the gut and the brain. So the idea is that by consuming this substance, you actually will eat less. It'll make you feel fuller sooner, therefore you won't eat as much. The efficacy and evidence currently, we really need more research in this area to tease out whether or not there's a real effect here. As far as side effects goes, currently there doesn't seem to be any reports of any side effects. And the application of it, you just need to follow what's on the directions by the manufacturer. There may be a possible U-shaped dose-response curve, so we need to be careful with this. You actually may end up, if you overconsume it, reduce the effect of the enterostatin. Gugglesterone, which has the active ingredient guggulu, which is found in several native plants from India. It's a resin product from these plants. The claim is that you will have hypercholesterolemic activity, so you'll lower your cholesterol levels, and you'll also increase thyroid hormone levels, which means that you raise your resting metabolic rate, which means you're going to burn more calories simply by consuming this substance for anything that you do throughout the day, and of course that could lead to reductions in fat mass. The efficacy and evidence of this, we see decreased total cholesterol, LDL cholesterol, and triglyceride, and actually increased HDL cholesterol. So that's going to reduce our risk for cardiovascular disease. We still need data, though, for this substance as a fat reducer. The effect on thyroid hormones, we're still not quite sure what's going on there. So as far as side effects are concerned, there may be some interactions with hypolipidemic medication, so we want to be on the lookout for that as well. The application of this ranges anywhere from 75 milligrams to about 1 gram per day. Hydroxycitric acid, or HCA, the active ingredient is HCA. The source of this is a small fruit, Garcinia cambogia. The claim is that it is an appetite suppressor via an enzyme, citrate lyase. So we can actually get weight loss because you're promoting fat burning here. In humans, it doesn't seem to be anything appreciable as far as a weight loss agent is concerned. Side effects, there's none that's reported. The application of this, about 2 to 3 doses of 750 to 1500 milligrams, each taken 30 to 60 minutes before mealtime. Beta-hydroxy beta-methylbutyrate. This is a metabolite of leucine, which is an amino acid. Quarter to about 1 gram of this substance is produced within the human body per day. Sources include catfish, citrus fruits, and breast milk. The claim is that we can increase muscle mass, increase strength, we can improve our recovery, and of course reduce fat mass. We can use it as an anti-catabolic agent to preserve muscle mass and reduce plasma cholesterol levels and protect ourselves against oxidative stress. As far as the efficacy and evidence goes, there's limited data for increases in muscle mass and strength, but it's too early to tell. Some evidence exists as far as an anti-catabolic agent, so you might be able to prevent muscle mass losses in cancer patients and AIDS patients and individuals who are undergoing intense exercise training, and perhaps even those individuals who are suffering from overtraining syndrome. There's the possibility that it might only work in novice trainees and for short durations, so about 2 to 4 weeks. So is there an adaptation to the supplement? We still need to figure that out. As far as side effects are concerned, there weren't any reported up to about 6 grams per day. The application of this is 3 to 6 grams per day and 2 to 3 divided doses. Medium chain triglycerides, or MCTs, these are fats. They're types of lipids. They contain 6, 8, 10, or 12 carbon atoms. They're absorbed very rapidly and burned for energy by the human gastrointestinal tract. As a source, we can extract them from coconut oil or palm kernel oil and package them into a supplement. The claim here is that you're going to get some glycogen sparing. So if we rely less on muscle glycogen, that means that we can delay muscular fatigue. We can also increase metabolic rate, which is helpful in weight loss. Ketones produced may actually spare muscle mass because those ketones can be used for energy. The efficacy and evidence for this doesn't appear very likely, but we do need some more research. There's quite a bit you'll find also on medium chain triglycerides and looking at clinical situations as well and using it to help patients. As far as side effects are concerned, ketone body production is a concern because ketones are acidic, so that may change the acid-base balance of blood, and especially in a diabetic, they certainly don't need that. Caution is warranted in patients with liver disease because ketones do have to be processed via the liver as well, so you don't want to tax the liver further by having additional ketones in the bloodstream. As far as another side effect, intestinal cramping with very, very large doses may also be a problem. As far as the application goes, about 1 to 2 tablespoons per day for a total of about 14 to 28 grams of total fat. Phosphorus. It is an essential nutrient. We need about 850 grams, or we have about 850 grams, in humans. About 80% of that phosphorus is contained in bone, so it's necessary to mineralize bone to put that mineral on top of the collagen matrix that exists in bone. The phosphagen system, the ATP, adenosine triphosphate, that's what we're talking about here, the phosphorus being attached to that ATP to provide energy. Can be used as a buffer. B vitamins needed. 2,3-diphosphoglycerate, the 2,3-DPG. That's an important substance that requires phosphorus. It's also a structural component of cell membranes and nucleic acids. Sources, it's abundant in foods, especially in sodas. If you like consuming sodas, you're going to get a lot of phosphorus that way. The claim here is that perhaps we can phosphate load, kind of like carbohydrate loading, and you get improved performance because there's more ATP synthesis and improved oxygen extraction in muscle because there's more 2,3-DPG in erythrocytes or red blood cells. So the efficacy and evidence for this, currently there's insufficient evidence to suggest that if we consume more phosphorus that we're going to get these effects. There's been quite a number of inconsistent findings, so we do need more work in this area. As far as side effects are concerned, too much phosphorus can actually upset calcium status. So there's a concern that this may lead to bone mineral density loss. Excess can also decrease the amount of iron absorption, so we want to be careful there as well. The application of this is about 4 grams per day. Pyruvate and dihydroxyacetone. This is a salt form of pyruvic acid. This is the end product of glycolysis. If you look over to the top right-hand corner of your screen, you see the steps of glycolysis. So what we're looking at is this very, very last step in glycolysis here, and consuming that substance to drive more ATP production. Sources of this, soybeans, animals, if you're consuming the cerebral cortex, so some animal brains. The claim here is that you can have improved endurance capacity, increase your insulin sensitivity, increase recovery, increase glycogen storage, and of course fat loss. Efficacy and evidence, there's weak supporting evidence for these claims. The side effects, you can get bowel rumbling. That funny looking spelling word there, that's borborygmus, which is the bowel rumbling. The flatulence can be increased there, and diarrhea. The practical application of this, about 1 to 5 grams per day. Clinical studies are using about 25 grams of pyruvate in addition to 75 grams of dihydroxyacetone. Downside of this is that it's very, very expensive. Yohimbine, it's bark extract, and the alpha-2 adrenal receptors are blocked when you ingest this substance, and those are important as far as vasodilation and vasoconstriction in the bloodstream. So basically, by consuming yohimbine, you may actually cause vasodilation. It's also a monoamine oxidase inhibitor, or a MAO inhibitor, which is going to allow increases in epinephrine. Fat cells have both alpha and beta receptors, which is going to help regulate lipolysis. Its source is from an African tree, as well as a South American herb. The claim here is that we increase testosterone, muscle mass, and strength, as well as increase beta receptor activity. Therefore, we're increasing lipolysis. It may also reduce impotency problems, so you're going to heighten sexual arousal. Currently, the efficacy and evidence, there's no supporting evidence for this, for the use of this substance in healthy individuals, particularly athletes. With a low energy diet, patients may lose more weight, and in one study they did lose more weight than a placebo, so perhaps there's something going on there. We need more research here. It may be helpful for the maintenance of energy expenditure, as found in a few studies. Side effects, feelings of panic, being clumsy, confused, having some anxious feelings, anxiety, mood disturbances, hallucinations, chills, tremors, nausea. There's a caution for pregnant women and diabetics and hypertensives and renal patients. They need to be careful with using this substance. There are some drug interactions, some known drug interactions with this, as you can see here. It interacts with foods containing tyramine. So the application of this, 10 to 30 milligrams per day, or 0.2 milligrams per kilogram of body mass.